Welcome to Comcast Newsmakers. I'm Leslie Weidenbender. I'm here at the Indiana State House with Representative Denny Zent, a Republican from Angola. Welcome.
Thank you.
This is your first session.
Exactly.
Tell us how things are going so far.
The long drive down is probably the biggest obstacle, so I come down Sunday nights and my wife's with me. We stay till Thursday night and then hustle back up because I treat my dental patients all day Friday.
You're a dentist, a healthcare provider. And so this big decision that the legislature has to make about Medicaid, about providing more health care to people, this is really important to you.
It's extremely important to me. The Affordable Care Act, otherwise known as Obamacare, is actually, if we can provide all of that care, we're going to need more providers or delegate more of the issues or some of the care to other providers, and I authored a bill that helped allow physicians' assistants to be able to be an extender for the physician. There's a lot of times the physician doesn't need to diagnose a common cold or maybe write some of those prescriptions, and under his supervision it allows the physician's assistants to actually be a further extension of that care, allows us to treat more people, and the quality is not going to be hurt in that area.
And that bill's headed to the Senate, is that right?
That's correct.
And are you feeling confident that that might be able to become law?
Well, at this point, this bill dealt more with the physician's assistants being allowed to write for additional controlled substances, and that needs to be done with a wary eye on to making sure that that's supervised. And I've worked with a number of physicians and their physicians' assistants. When you get a confidence level with them, there's not an issue here at all. I think it's a good move.
So what do you think, how should the state proceed in this Medicaid arena?
Interesting question. My concern is, as a small businessman myself, the financials of the people that are going to be paying for this, the federal government, I'm a little concerned about their ability, because initially they're going to pay for 100%, and then it's going to roll down where the state picks up some now. So we pick up an estimate of 400,000 individuals in Indiana. There's a lot of cost there, and even 10% of that cost could really balloon out of proportion. Now, to me as a provider and as a dentist, a lot of the savings are predicated on the fact that people are going to take personal responsibility. I can't get them to brush their teeth. So are we going to be able to generate enough savings with personal responsibility with these people maybe having healthy habits and everything else to actually get those savings? I got a wary eye on that. So I mean, I can understand everybody's kind of trepidation as far as let's accept it as is, and that's just the tip of the iceberg.
The Senate, of course, has passed a bill that would create a block grant, or ask the federal government for a Medicaid block grant. Do you think that's a good approach?
I would like to see the states get more of their money back with fewer strings. Do I think it's a good approach? I think so. Do I think the administration is going to approve of it? I don't think they're big on block grants. So we're going to have to see how that plays out.
And so finally, and we just have a few seconds, what would you like to see the one thing that Indiana do in this session about Medicaid?
About Medicaid?
Or about health care?
About health care. I think that we need to realize that all the statistics that show that we're going to be so much better off under this program or that are reliant on the fact that the patients actually are going to do what we want them to do, and that's not always, compliance is not there.
Representative Slager, Representative Zent, sorry, thank you so much for being here. I really appreciate it.
Not a problem.
I'm Leslie Weidenbender with Comcast Newsmakers.